Good morning, everybody. I think we're ready. All right, and so let's see here. We're going to begin today. Good morning, and we're going to be talking about our deep dive topic for today is going to be specifically around the Gateway Center, a concept very important and critical, and homelessness in general in Albuquerque, one also in many ways, has not been front and center given all things Corona. So we do want to spend some time on it today, and we have a number of special guests here that I'm very excited to see who are going to help provide updates on that. So let me actually just begin by saying that we are joined by a representative from UNM, Dr. McNeese. I think he's a doctor. Just checking. No, he's giving me the no. Okay. We'll introduce him later. And then we have our City Council President, Pat Davis. We're going to have County Commissioner Jim Cawley is also here, and also our COO, Lawrence Royale, and all things family and community, Carol Pierce. So to begin, let's talk about a couple of updates from Central New Mexico. And first, to mention that beginning Wednesday, May 6th, all large grocery and large retail spaces greater than 50,000 square feet and all restaurants currently operating curbside and delivery will be required to ensure that all employees have at least a cloth face covering. So this is pursuant to what the state spoke about yesterday, and it means that all employees must wear their face coverings in the workplace at all times when in the presence of others. Also, beginning May 11th, all essential businesses of any size currently operating under the public health order must comply with the face covering requirement. And all employees are strongly encouraged to acquire the face coverings for all employees. So, we want businesses to really provide this, obviously, for all their employees in preparation for hopefully a phase one opening in mid-May. Now, retailers are not required to provide face coverings for customers, but that is encouraged to make them available, and strongly encouraged them to also post signage and so forth regarding wearing masks. Okay, so let's talk a little bit about some government continuity areas. We have had several briefings on homelessness during the time of Corona in this format, and so we can touch on that a little bit. I'm just going to say a few things briefly about that because we really want to focus on the future today, but of course we'll take questions about what's happening currently, and they're very much connected. So the West Side shelter continues to be open. We've kept that open 24/7 since this started. We appointed a medical director out there. We have been offering testing out there again since the outbreak began. Fortunately, as of right now, I believe we have no positive cases, so that's a very good thing. And a credit to Heading Home, who helps us run that, as well as all our city staff and so forth and partners who do that. I want to mention there are about 300 folks that are basically living out of there right now. And that, of course, for folks who aren't too familiar with this topic, is unfortunately the old jail on the West Side. And we have to bus folks back and forth each day. It's the same dynamic that we've had for the last several years. As a reminder, before that, this was only open in the winter. We started keeping it open year-round to try and help curb our homelessness challenges. I also want to mention this is particularly important because our partners are doing the best that they can, whether it's HopeWorks or Healthcare for the Homeless or The Rock. These are all entities that deal with hundreds of homeless folks a day. However, since Corona has started, they have also been extremely limited in their offerings as well, especially HopeWorks and Noonday. And that is also, of course, why we're seeing a big influx of homeless on the street all over our city. Right now, we're the only entity operating at full capacity and enhanced capacity. Our partners have been unable to do that, and we completely understand why. But we are hoping that over the course of May, as we begin to open up, we can also get our partners up and running because we desperately need their help, especially as we get into the summer months. Now, let's talk a little bit about the Gateway Center. And again, I want to kind of remind folks, because a lot of this has been it's hard to remember what the world was like in February. So as a very brief summary, believe it or not, in November, which wasn't that long ago, the voters gave a mandate to the city of Albuquerque to step up and address homelessness with a 24/7 gateway center. And so that was on the ballot in November. Appreciated council's support to get that out there. And the voters chose to do this. And we know that there's a moral opportunity to bring institutions together and try and work on this. And of course, we also know that homelessness has been growing. This is something we see hundreds of new homeless folks in all of our counts, all of our projections that we do repeatedly throughout the year. And we went through a process where we had multiple community meetings, stakeholder meetings. We have a homeless advisory group that meets quarterly, but also met, it's, again, hard to remember, but back at the convention center, we had hundreds of folks in a community town hall about homelessness. We got over 1,000, thousands of people gave us online input about where they wanted this. And of course, no neighborhood wanted it in their district. We understand that. So we got pros and cons, and we narrowed it down to basically 3 sites. A UNM location, really at the south, somewhat proximate to the OMI, the Office of Medical Investigators, along the freeway there. And that's sort of University, the freeway, and Indian School, roughly. The old Loveless facility on Gibson, of course, lots changed there since too. And then some area around where the current Coronado Park configuration is, just in the sense that all the providers are there. And again, this was as a result of all that input. We also had consultants look at this and so forth. So that was sort of 3 options. Fast forward, we're catching up. Fast forward to, it was, I think, the end of March. And I remember it because it was the day after Councilor Lancena was appointed, and it was also the day after Corona arrived in New Mexico. We shared with UNM, after much work, that they declined to pursue a major site on that piece of land. Now, that piece of land was our top choice, just primarily because we could do it fast and we could do it customized. And also, it was therefore also cheaper. And with that site off the table, now there's a very, very different game plan, and that's what we're going to begin to talk about today. So once that site was ruled out, we did establish a working group with counselors and with the county and with UNMH on how we're going to look at this in a new context with that site being off the table. It's also in the city specifically mentioned, and I'm going to repeat this numerous times, that we are open to a combination of multiple sites. We always have been, and especially with that one off the table, there really is no alternative. So again, want to repeat, we are open to multiple sites. And so for those of you who continue to call and ask that question, I'll say it for the 3rd time, we are open to multiple sites. So what we did is this working group has been doing some excellent work. We were able to pair some counselors who are knowledgeable on the topic, who also represent areas that might likely be affected, as well as one of our new county commissioners with similar experience and some other county commissioners, and also folks at UNM, because they have a slice that they might be interested in as well. And they have been working as a working group to come up with how can we really deal with homelessness in a comprehensive way, but also in a way that honors the urgency and what the voters voted on. And so we're going to hear some updates from that team today. And from the mayor's perspective, Lawrence Rael, our COO, has been in charge of this, so he's going to share a few remarks on this. Now, the core concept still applies. One is that this has never been a be-all, end-all solution to all things homelessness. That was never what was pitched to the voters. Rather, it was an urgent, low-barrier, 24/7, easy access to services and transportation center that fits the Phase 1 dollar amount. I believe it was about $14 million that was approved. And we know that we have to look at all the other areas. So it is by no means, again, exclusionary. It's just what the voters voted on. And it's important that we do that in the context of all these other things: supportive housing, housing vouchers, the work we're doing with behavioral health. So now, wonderfully, this working group is trying to put those pieces together in a way that will work with, the sort of obvious remaining sites that are available, and maybe there'll be some new ones. But we're looking at a collaborative process to explore all these options and look at a viable multi-site model. And we're also doing this. We meet with our partners on a daily, if not weekly basis because of the coronavirus. So I do want to emphasize too, I think it's fair to say the homeless provider and advocacy community has never been so synced up with the city and the county, ever. And unfortunately, that's because of Corona, but fortunately, that is the case. So I think in many ways, we have a much better sort of team and perspective going into this process. So we're going to continue the collaborative efforts, and we're going to really look to this working group for guidance. And we also know that, and I'll wrap up here and we'll tee up our council president next. The coronavirus has also shown us how important this is. The amount of funding and logistics that we have to deal with going back and forth to the west side and dealing with emergency locations to put people in. And how do we even get volunteer groups who want to help coordinate it? Without this low barrier clearinghouse place for folks, it is extremely hard. And we are all, again, using a ton of resources, both financially and in terms of people, trying to figure out how to do this in a way that would be so much simpler if we had this concept of a gateway center. And that concept could be, again, size-wise, anywhere from 75 to 150. The scale is less important than having an adequate place where we can provide services in a clearinghouse fashion for a couple of days for folks. So this is something now that, to borrow a medical term, is a more acute need than it even was before. And that's why I'm glad that our partners at the county and UNMH are together with us on this working group. And so I really appreciate the extra effort they are putting in. So with that, let's begin with our council president, Pat Davis. Come on up.
Thanks, Mayor. And good morning, and thanks, Mayor, for making this the topic of the day. We appreciate that. As you've heard from folks calling your office, and we've heard from ours, and folks are still interested in this. And it's important for people to know that even while we're working on all of the COVID response, we're still working on these critical issues in the city, and we're still continuing to work. As the mayor said, we know that our homeless providers and our homeless system is doing all it can with what we have today. But it's very clear, and voters voted for and gave us the money to fix, very clear that we need to expand the carrying capacity of our providers, of our service providers, of our capacity to help people from housing and basic services. And the gateway model is successful with some of our partners already and has been in other cities around the country. But it was also clear that we needed to create a more formal process for decision making. We've taken, as the mayor said, thousands of pieces of public input and consultant data and input. And so earlier this year, just before all the COVID piece began, we began working with the counselors and beginning with the counselors and the commissioners who represent downtown and sort of southeast Albuquerque, those neighborhoods most impacted by homelessness, to look at what it would look like to create that joint governing structure. How could we make decisions together, not pitting neighborhood against neighborhood or county versus city? And so we came a few weeks ago, brought the mayor sort of a framework for how we thought we could start selling that idea and creating that joint governance structure. And to his credit, the mayor stepped up very quickly, asked other city departments to begin to evaluate and work out these details. And so that's going to begin, we think, with a joint city, county, and our other partners, including UNM and homeless providers, a joint governance group modeled sort of on the Criminal Justice Coordinating Council, where we have technical experts, decision makers, in order to evaluate and give a public, transparent place for us to look at those options and make those decisions. We recognize that the gateway model doesn't work if someone comes in the front door and there are not enough beds on the back door to send someone. And so we want to look at a comprehensive, long-range plan to develop additional supportive housing and services for all of the people who need those services. And we want to be sure that we're prioritizing good neighbor policies, coming up with strategies to support neighborhoods who are taking on these challenges, whether they're overwhelmed now or willing to take on new services to help their neighbors, including those unhoused neighbors. And so we've had lots of input, but this is going to be a good start. And so, as the mayor said, this is exactly what we ought to be doing. People want to see the city and the county and UNM and all of their governments working together. And I'm excited to say that after months of conversation and looking at this strategy, I think we have a good strategy that would help us build a joint city-county governing model, decision-making model that embraces the Gateway model as the hub for this long-term comprehensive plan to address homelessness and housing in our community. And every long journey starts with a first step. These are absolutely critical ones. And so in the next few weeks, I think the city and the city council and county commission are going to be prepared to bring sort of a framework for that model back to our colleagues for ratification so that we can create that place where we can start making those decisions, start allocating those dollars, and start bringing our partners into this process. And so I want to acknowledge and thank my colleague, Jim Colley, our newest county commissioner, who's been a part of this process from the very beginning. And I want to give him an opportunity to talk from his perspective, from the county's perspective, about this collaboration. Thanks, Jim.
Lawrence, you want to come now? Go ahead.
Oh, I'm sorry.
No, that's fine.
We'll go, Jim.
We can do this.
I didn't mean to go out of line.
I never want to step in Lawrence's way, so, we try to do that. Mr. Mayor, thank you for the opportunity to be here. The county commission has a mandate to do behavioral health in the same way that the city has a mandate to do homelessness. And they overlap in critical ways. And one of the wonderful things we have about the opportunity to plan together is that we make sure that each of us have the opportunity to bring what we do best to the table. The county and the county commission have been working now for a very long time to deal with the whole issue of a continuity of care. Once you arrive in the community and you're having certain kind of challenges, whether it's homelessness or behavioral health, we have the ability to step into that process. And through the Gateway Center, which we're delighted to be associated with, it's a very real opportunity to get hold of some of these issues early and do it well and do it together. So the Gateway whole concept is a gateway not only just to the issue of how do we confront the very real issues of homelessness, but how do we confront some of the really basic issues of behavioral health that go along with those same kind of things. So the county is delighted to be here. So, Mr. Mayor, on behalf of the chair of the commission, Lonnie Talbert, and the whole commission, and our county manager, we're delighted to be involved in this process and really believe that what we will come out with is a product that will be amplified by our working together. And I'm really excited about that. The county, as you know, has already begun process on what we call the Tiny Home Village. It's close to Central and Texas. And the Tiny Home Village is kind of the next step into residential housing out of the experience of living on the street. It's not a full home, it's not a full house, but it gives people the ability to learn new habits and learn new styles of living together. And that's in process, and we hope that is open and operating in October of this year, part of what the county is doing in that continuity of care we talked about. Well, we're delighted to be participating in this, and we're excited about the possibility of multiple site models potentially across the whole county. We think it strengthens both the city and the county together, and we're excited to be here. So thank you, Mr. Mayor.
All right, thank you so much, Counselor and Commissioner. Really appreciate also those words about that continuum of care. This is what this partnership will bring. And so, again, we'll be fleshing out the details both in terms of decision-making and governance and also, getting down to some brass tacks on what we can actually accomplish in the short term over the summer. And I do want to mention that all the commissioners, and I want to mention Commissioner Piscotti and Commissioner O'Malley, who've also been heavily involved, as well as Councilor Ike Benton. They've been part of the working groups as well. And I want to highlight that, we all agreed. I remember it was like the first day of Corona. We all agreed that this working group still has to work. And that was a decision we made now almost 6 weeks ago. And I just say that because it's a reflection of how important we all feel about this. And I also want to mention, too, our county manager, Julie Morgas-Baca, as well, from the staff perspective, being involved in that, too. And I just appreciate everyone finding ways to meet and however we can, and just like the rest of us, part of government continuity for us is dealing with these big issues that we know are now huge, meaning homelessness and corona, but also not going away, right? This was a big issue beforehand. So really appreciate everyone's dedication to that. And now I want to create a little space for UNM's representative. Rodney McNeese is the executive director of behavioral health and some other things. So we're going to let him maybe intro himself. And then he's going to be on the big screen here to speak a little bit about, and then two, I want to mention, you know, there's UNM and UNMH. He's kind of officially, I believe, on the UNMH side. So we'll try and be clear about that as well. So Rodney, go ahead.
Thank you, Mayor Keller. I really appreciate the opportunity to be here today. And I really want to thank the mayor for his leadership on this issue. As we go forward, especially given the current health emergency, it's very likely that unfortunately the issue of homelessness will only get worse over time, at least in the short term. And so that's part of why the planning for this facility and trying to move forward with the development of services for this facility and for the homeless population in general is just incredibly important now, given where we're at with the health crisis. There's a long history of collaboration with the city in Bernalillo County and UNM, much of it through UNM Hospital, but through other areas of UNM as well, that have been focused on multiple areas. But lately, there really has been a huge amount of work on behavioral health, which really touches the homeless population extensively. And as we go forward with developing services that are appropriate for folks that will be utilizing the Gateway Center, we'll continue to focus on trying to actually build a continuum of care for those patients and to assure that they have access to needed services. And UNM is proud to be a partner with the city and county in building out that continuum and establishing that service array. So, Mayor, again, thank you very much for your leadership, and we very much appreciate being included and involved in this process. Thank you.
Thanks so much, Rodney. We appreciate that and look forward to at some point getting together soon. That's not always digital, but thanks for being able to pipe in today. And also want to take a minute to thank our AV crew because the sound sounded great. And so I haven't been, I don't always see the comments on this, but I know everyone's always asking about the sound. So it sounds great, at least from the corner of the room where I was standing. So good job. All right. Now let's hear a little bit from kind of the city folks who are, Lawrence is really focused on, Lawrence Royale, our CEO, is focused on kind of that site location concept, which, fundamentally all of these things have to happen somewhere. So I'm going to turn it over to him, and then we'll hear really from our, kind of content expert, the woman who works on this along with her team each and every day, Carol Pierce. So Lawrence Royale.
Thanks, Mayor. I appreciate it. And Commissioner and Councilor, thank you for joining us, and Rodney as well. Just again, as the mayor said early on, we back in March, the mayor basically, after we had the conversations with UNM and the UNM site was off the table, the mayor directed the administration, us in particular, me, to begin a process to bring folks together and to create a working group to work on this issue. And of course, as we know that this issue of homelessness really is not an issue that one government is going to solve all by themselves. That we really have to, like many of the issues that happen in our communities, it really is about partnerships and about working together. I will say that both Commissioner Colley and and Councilor Davis, along with Councilor Benton, had conversations with the mayor and then ultimately included me in the conversations about, look, we've got to work with this process so that because we all do a certain piece to help support providing services to our homeless community. As a result of those conversations, we put together this working group that really is about a very high-level conversation about how do we coordinate conversations amongst the three governmental entities that are involved here, to include the University of New Mexico. And so we asked the counselors to give us a couple of folks from the council, a couple of commissioners, and then asked the president of the university to appoint a couple of folks to sit and start having these conversations about how do we basically come together to provide the structure, if you will, the governance structure on managing how we not only invest our public dollars, but also how we invest those public dollars in actual facilities, and then form a structure that ultimately has a working group that continues to monitor the way the system, if we will, works. And COVID is one really classic example of how we are all working together, not necessarily as a result of the structure we're working on, but as a result of the fact that as public officials, the counselors, the commissioners, and the university all know that we're part of this. But that is one example of how a governance structure that we're proposing would really create a much more streamlined approach and would create a process for us to have the conversation. So we've had about 4 meetings over the last month and a half or so. And we've begun to formulate a couple of things that are important. One is this governance structure, as Councilor Davis spoke earlier, is we use a model that has been working for the city and the county in particular, and the courts, and in particularly as we manage the criminal justice coordinating, or the criminal justice system in the county. That model has resulted in a lot of conversation, a lot of sharing of ideas, and quite frankly, a lot of streamlining of operations, simply because there are so many people that, or entities that are involved in governing just how we deal with that issue in our community. We use that model to develop a structure for a homeless coordinating council that is comprised of the University of New Mexico, the city of Albuquerque, and Bernalillo County. That structure is in draft form as we speak. It's been sent to all the governmental entities that are participating for their input, et cetera. We're hopeful that within the next 15 or so days that we are going to have that structure introduced by both the county, the city, and hopefully adopted by the Board of Regents, so that we set up this basic structure to begin to have the long-term conversations about how we deal with all of the issues associated with our homelessness in our community, and more importantly, how do we coordinate our public dollars to make the best decisions and the most efficient decisions, with keeping in mind that we know that the impacts to our neighborhoods are already there, and how do we work with them as well through this process of the coordinating council to create subcommittees to include the folks and our providers and others who we know have the expertise and the wherewithal to help us deal with all the variable issues that we deal with as we're trying to assist and help our homeless community. So it will be a very robust process, but one that I think will yield some good results as we move forward. So the other two structures that we were looking at is also our services provider. So we created a subgroup that Carol will talk about, our Director of Family and Community Services. A service provider group has been working. Rodney from the university and his folks have been involved with that, and as well as the county, Margarita from the county, who does their behavioral health program, working on making sure that we're all in sync with what the county is doing on behavioral health, what we're doing with, for example, the West Side facility and the services we're providing, making sure that the university has a role with that and has some expertise that could really be helpful. So we have a subcommittee working on that. We have a subcommittee working on the structure, as I talked about earlier. And then we're also, obviously, the next level of discussions will be down the road is the funding issues and the facility issues. Where are the facilities going to be located? What size of facilities, et cetera, and how do we put that together? It's all still a very, very work in process, but I think it's important to know that as the mayor said earlier, this is really about working together to make sure that we're doing the best job we can, especially during this time when resources are going to be really, really challenging for all of us across New Mexico, across the country, quite frankly, those of us in government. So doing this in an efficient manner really is important. And so with that, Mayor, I'm going to turn it over to you, and you can introduce our director.
Okay, so we're going to talk about some of the kind of working aspects of this with Carol Pierce. One thing I want to mention in terms of how our strategy on this is, to summarize it, is basically that, normally the mayor's office makes recommendations to council, and then council kind of modifies or says yes or no. And then after that happens, somebody usually gets a county commissioner to do the same thing at the county. So then they go to the county commission modifies, says yes or no. And then UNM takes a recommendation and goes to the regents, and then it's modified and says yes or no. The concept here is actually to do all that on the front end, right? So if this coordinating council can basically agree, we're sort of trusting that the respective governing bodies are going to be okay with it. And so, again, it's a concept we've used in many ways to bridge together city and county and advocates and providers. And so we're going to try it in this context as well. But I want to mention to folks, it's kind of one of those where if you put in a lot more effort sort of up front, it should be easier on the back end. I mean, that is the concept. And again, that way it's more smooth when it goes to the respective governing bodies and so forth. And so hopefully this will work in that context as well. So with some details on what we're actually going to be working on, Carol Pierce.
Thank you, Mayor, for the opportunity. To build on what our COO, Lawrence Royale, mentioned, part of the Gateway Task Force is a services subgroup. And Rodney, glad he could be here today, along with Margarita Chavez with the county, along with Nicole Taylor from the City Council, along with our Deputy Director, Lisa Uval, myself, along with Quinn Donne, who I'll introduce shortly. We've been coming together over the last several weeks to really look at the services and what it really means to address the gaps that currently exist in our community and what services need to be augmented to really respond to the needs that people without homes. So I think that it is a starting point that we're coming together, and I just so applaud the effort. It really takes a whole community to address the needs with people without homes because they're complex and have many facets to it. The next piece that we will be doing, and we're actually beginning this now, is beginning to have conversations and continuing those conversations with our providers. They bring the expertise to the table, longstanding providers that have been in our community. I think what's been maybe this new work adds to it is some coordination, all of us working together for the collective aim. I think we can't talk about homelessness without saying what the collective aim is. Hands down, the collective aim is permanent supportive housing. I think we've said that all along. Do we have enough in our community right now? No, and that's part of what we've got to really work toward. But in order to do that, we've also got to address the gaps in the services that are needed for when people are put into homes or have a home, what the kind of support that they need. So we've had this collaborative process working together. As we look at a gateway system, it always has and will involve all of our providers out there. And so they have different pieces of the puzzle that they will contribute, and their expertise is important. I think it's really important when we talk about people without homes, there are many different populations, and I think that's been an important piece of the discussion. There are women without homes. There are families without homes. There are men. There are young people that are probably too frightened to really go into a shelter and maybe on our streets that we need to connect to services. So all those are a piece of the discussion that we're having. The city is very excited that we have a Gateway project coordinator. Her name is Quinn Donne. She's with us today, and she began last week, but we've always known that we needed to add some depth and more bandwidth to the city team to help move this high priority forward. So what's really great about Quinn, many things, but she comes with us with some frontline experience and is really knows a lot of our community providers already and will be on the front line working with us on this project. So welcome, Quinn. We're really excited to have you part of the team. Quinn will be joining us this afternoon with Rodney and others as we have a subcommittee working group, so you'll get to meet her in more depth. So as we're moving forward on the Gateway project, as we've heard, we're doing that concurrently while we're addressing COVID. So I want to acknowledge that ever since COVID came, but before, we had a medical team going out the 20 miles outside of town, out to our Westside Emergency Housing Center to address the medical behavioral health needs case management, because we knew we needed to come together, we needed to reduce the number of 911 calls, pulling AFR, Albuquerque Fire and Rescue, out of service to go out there and to have a group of people out there. I will forever be grateful that we began that last May with the University of New Mexico, with Albuquerque Healthcare for the Homeless, with First Nations, with Centro Savila. And that in part was possible because of our partnership with the county and the money that they brought to the table and UNM's willingness to have people at the table. Because we had that partnership, that's why we were ahead of the game to respond to COVID. So as the mayor mentioned, do we talk weekly? Yes, we talk daily, and sometimes a couple of times a day with all of our homeless providers on the front line. And why? Because the way to reduce the transmission of COVID is screening and testing, and we are doing that among our people without homes. The Westside Emergency Housing Center became a COVID testing site early on, and now we have a whole strategy where we are working with partners, testing that full population, and we work in great partnership along with the city's Emergency Operations Center if and when there is a positive, how we can provide the support. Now, this would all be much easier if we didn't have 350 people usually every night out at the west side. It would be easier if we were more connected, closer in town, and that day will come, and we're excited for that day. But in the meantime, we continue to speak daily, connect the resources, and to reduce the transmission of COVID by screening people without homes and testing as well. I do want to acknowledge that in this time, we are working directly with people who are on our streets. So Albuquerque Healthcare for the Homeless has a street outreach team. First Nations has an outreach team. Heading Home has an outreach team. And they're meeting twice a week to coordinate their work together, so we're really getting the information about COVID out in the community, getting people screened, getting people tested. I'm grateful that we are really ahead of the curve in compared to so many communities because we have the tight communication, we have the resources, and that we are connecting people to the needed resources that they have. I also would like to add that I think we've got some steps to go, but I think by us all working together, there's no question that we will make a difference in our community. I think we're already doing that, and I look forward to the future and these next steps, all of us together. Thank you.
Thanks so much, Carol, and really appreciate that. Want to mention we also continue all the other aspects of that spectrum that Commissioner Colley mentioned, whether it's supportive housing, whether it's the tiny homes work, or vouchers. And we do know that, we've come out strong that the fastest way, the gateway, if you will, to supportive housing is vouchers. And so this is a program we continue to raise money for. We have received wonderfully yesterday a woman, she was kind enough and she gave her stimulus check, like from the government, to Albuquerque for housing vouchers, to the One Albuquerque Fund. And she said, this is more important for these folks than it is for me. And in total, actually, we're almost over 100,000 in donations into the city programs, either the Micro Business Fund or the housing voucher programs from the public and through the One Albuquerque Foundation. So people can do that still. If you would like to donate, onealbuquerque.org is the easiest way to do it. So this is something, too, that before we take questions, I just want to mention that for all the work that Carol and her team is doing, and of course, the folks at the county, but you know, Albuquerque in some ways is demonstrating national leadership, and we have handled the homeless situation here better than many, many cities around the country. And I know this because we are on conference of mayor calls right now, in fact, that I'm missing, and we talk about this with mayors all around the country. And if you look about what's happening in other cities, and I don't want to be specific to kind of keep things positive, but many of our neighboring cities in the western U.S., and especially out on the West Coast, they are just underwater when it comes to dealing with Corona and the homeless population. You know, knock on wood, we're grateful, we're blessed to have the team that we have. And in Albuquerque, we're doing okay. I mean, we got a lot of work to do and a long road ahead. But we are in a much, much better position than our colleagues, thanks to Carol and her team and all the partners that are part of that. Now, of course, our city invests in this, tens of millions of dollars every year. It's been this way for decades. It's through council's support, and it has been something that a lot of times people forget, that our partnerships are multiple with large agencies, and they include heavy city subsidization, which is, again, just a reflection of the taxpayers' will through council to continue to do that. And it has paid off because we have not had a giant Corona homeless crisis like a lot of other major cities. So with that, we'll be here for questions. I'll kind of take them and farm them out to the relevant party. And we usually prioritize those here in person first. Go ahead.
So a lot of planning at this point seems to be for a 300-bed shelter, but is that off the table now?
Yes, I want to be clear, that was never the case. It was never the case. And it was a case that we were looking at and thinking through with UNM. That's true. That is now currently off the table. So unless there's an opportunity that arises, we'll look at it. But right now, that's off the table, and it was one of many scenarios that we were interested in.
Okay, so there is no 300-bed shelter on the table, or there's no 300-bed shelter at UNM on the table?
Right now, there's no 300-bed shelter on the table.
Okay. So if you go to a scattered site model, is that going to delay the process of getting these things built? Because you're not just dealing with one neighborhood now, you're dealing with several.
Absolutely. So we have two realities. When UNM declined the opportunity, that meant everything's going to take longer. That was one of the biggest aspects of the UNM property. So that decision was made for us by UNM. So this is going to take longer. And the second aspect of this is Corona means this is all going to take longer. So we're trying to make sure we're taking care of everyone right now. So the efforts that's being spent on triaging our current population is also going to mean this project is going to take longer.
Do you have a goal date for when you would actually have something starting?
You know, at this point, because of Corona and because of the UNM site being off the table, we do not. However, we're optimistic that with the governing body and the working group that we're putting together, you know, at some point this year, we certainly need to map out a timeline. And so that's a to-do item for the group, and they'll be working on that.
Cost-wise, is $14 million going to be enough to do scattered site?
So again, it's a great question. Costs go up the more sites you have. It's just by definition. However, we might be able to utilize some existing sites and existing facilities, which means costs could go down. So I think we're all confident we have enough money for a phase one concept as per what the voters voted on. But you know what that looks like and how big it is and so forth depends on what the working group will be doing this summer.
Did any of the planning that went into the site selection that came up with those three locations, how relevant is that now?
It's still very relevant, right? Why we needed to use numbers is, you know, at some point, it's not lost on me or any of the other members that there's a pragmatic piece, right? We can do a lot of planning and we can do governance, but at some point you have to like count beds and you have to count acres and you have to find available acreage. And so that part is actually very helpful. So we got a heads up on a lot of different properties, and again, all of those, in fact, have been publicly disclosed and so forth. And look, even the old Presbyterian in some form or another, Old Lovelace, sorry, the Old Lovelace, you know, now that it's being used in part for Corona, that kind of cuts both ways. In one hand, this might be more helpful. On the other hand, we'll have to see because it might be in use for a long time. So I think that homework has actually been able to allow the working group to actually get to work on some of these issues and not have to say, well, we need more research. So that's the good news, is we got the research done.
Is there still a chance you build something in the Coronado Park area?
I think right now everything is on the table in terms of all the past sites we've looked at, which certainly includes, again, as I mentioned, the old Loveless, certainly includes areas around Coronado and other areas if they're available. Kind of fun. You get the whole show. We'll take some from online and also we'll see where those go and our commissioners and councilors can chime in too.
Okay, we have one from, sorry, what was the question?
Oh yeah. So my apologies. We haven't had an online guest in a long time, and I didn't repeat any of her questions. So in hindsight, we talked about the different sites and the costs and the timeline. And so that's what the questions were mostly about.
Okay, we have one question here from Chris McKee at KRQE. Is it fair to say that the city is going back to square one or sort of restarting the Gateway Center project? It feels like before the coronavirus, the city was fast tracking the project seemingly on its own with public meetings and a site selection report, but now the city has created this working group with the county and others.
So the question is really about, are we back to square one? And we were sort of fast tracking it before, and what's the difference now? I think there's two things. Look, conceptually, that is true. Once the UNM site was off the table, we absolutely had to regroup, and we were fast tracking it, and we were going to push hard to get that done. But if it's off the table, it's off the table. So we are, I think, in a regrouping phase, but one that is also, I think, in many ways better. It's with an eye towards a comprehensive solution, and it's with an eye towards collaboration. The bottom line is now, given what's happened with sites and so forth, we very much are dependent on our partners. And council always had to vote on this project anyway. So in many ways, I think now this has set us up for an investment for long-term homelessness spectrum of solutions over the course of decades, well beyond any of the elected officials that are around. So I have to say, I actually feel better about this, but it will be slower. And so, that might be a good segue if our commissioner or counselor want to add anything. Sound good? Okay, we'll keep going.
Okay, we have one from Peter Rice at the Downtown Albuquerque News. Are neighborhoods where the Gateway Center might be located represented on the working group, and if so, how?
Okay, that's a good one. So I'm going to hand that over to some of the members of our working group, especially very relevant, of course, because City Council has council representation on there. Councilor Davis.
So the question was, are the neighborhoods that might be impacted, expanded out of downtown, are they included in the working group? So the short answer is, as the mayor said, a few months ago, we have been, as the public conversation and evaluation of sort of our needs has been around, we recognize the need for about 300 emergency beds somewhere in the city. But when the UNM option came off the table, we began looking at some other options that would also create those incentives. So this is a multi-year plan, and I'm going to get back to the final answer here. We recognize that we need hundreds of new long-term permanent supportive housing units, and those have to be developed in partnership with those emergency beds and emergency services. And so this is a joint partnership for us to make those decisions. So if you look at the Criminal Justice Coordinating Council, that's a great model, we think, for bringing government, nonprofit, and advocacy partners all together in one spot. And so how that works is that the City Council, the County Commission, the Mayor's Office, their APD, also the partners from the representing the McClendon group from the jail who represent inmates and others, all sit around the table, not just government officials. And that's why we think this is a good model. So what we are proposing is, as Lawrence laid out, Mr. Real laid out earlier, is that both the City Council and the County Commission and the Mayor's Office would work along with UNM to create this governing structure that includes both government partners and community partners who all sit around the table to work out these issues. We don't think it's the mayor's responsibility to solve this problem. It's not the county's responsibility to fund. We recognize that there has to be a real strong input from neighborhoods. And one of the things we heard specifically from the councilors and commissioners whose neighborhoods are most impacted is that part of developing, whether we open a smaller gateway center as a model, whether it's downtown or anywhere else, is that we have to have a good neighbor partnership. We have been designing and working on that with Wells Park on the smaller center that's going in in their neighborhood that's a joint city-county project. And we think there's a model here. Whether it's Coronado or the International District or anywhere else, those neighborhoods need investments, and we want to work with them to do that. So this is a good model. The first step is getting everybody to agree that this will be the folks to do that. But then that provides a transparent place for everybody to see what's happening and provide input. And there's an opportunity to allow community folks to have a vote that would be as important and as powerful as mine or the commissioners or anybody else's when we get to that place. Thanks.
Okay, thank you. Other questions?
Thank you. We have another question from Chris McKee at KRQE. Is the county planning to contribute any funds to the building of the facility or towards the operation of services at the future facility?
The question is from, or is for the county and what their plans are with respect to resources and support, et cetera. So that one might be tough for Commissioner, but we'll give him up here, give him a shot.
I'd like to say thank you, Mr. Mayor, but I think it's a very good question, and the real answer is that we're not at that place yet. The simple answer is that we're going to know a whole lot more about what kind of costs are related and what kinds of services need to be part of each of the processes when we get that planning done. So, is Bernalillo County in on the project? Yes, we are. We have behavioral health money. That's important. We plan to use it for behavioral health, which is an integral part of the gateway system. So does that mean that a dollar from the county is going to put a brick in the gateway center? I don't know. But I can tell you that behavioral health is going to be there big time to triage people out into community services, and that is the appropriate use of funds we have available, as is the county's acquiring property and building buildings, the appropriate use of the funds they have available. So we're all in it. We all have costs, and we're going to expend those dollars as they are intended.
Okay, thank you. We have one more from Peter Rice at the Downtown Albuquerque News. So just to be clear, you're looking at 2 or more sites, possibly sites other than Loveless or the old Loveless or the Coronado County.
Yes, the question is about, we're looking at 2 or more sites, and that is true. The county actually had been researching some interesting sites, and as different buildings become available, we're very much open to additional sites. But of course, we've got the homework done kind of on the first 2, and so you're correct.
Okay, thank you, Mayor. And one more question from Chris McKee at KRQE. Is this disappointing at all to be in this place in a situation where the project will take longer to get off the ground?
Well, I think the question is this disappointing to be in this place? I think in general, look, you always want to try and move with urgency and effectiveness, especially when the voters vote on something. But, you also want to be pragmatic, and you want to be thoughtful, and you want to be collaborative. So I think for me, actually, this is just a recognition of where we're at. And, you have one kind of fast track idea. It doesn't work out. We've got this idea. And I will say what I love about this, and I've always loved about it, is this plan and this working group is about building institutions for the future, well beyond any particular person. And so I'm very comfortable telling the voters that saying, I know you voted on this, but now we're going to do this together, and we're going to do it right and for the long term. And for that reason, actually, I feel very good about where we're at.
Okay, thank you. And we have one more question. I think this is our last question from Zoom, from Chris McKee. In general, just a coronavirus-related question. City councilors passed a memorial on Monday that in part requests that the mayor establish a program to provide resources to businesses for purchase of health screening and other equipment needed to implement reopening protocols. Are you seeking to or already working to create a program like that?
So the question is about the memorial that passed, and if we're working on a program to help small businesses with masks and so forth. And so, as we mentioned then, we actually have been doing that already, and we're hoping to be able to scale up how much we can do that for small businesses. So the answer is absolutely yes. And I think the connection just between those 2 questions is, as mayor, I want everything done tomorrow, and everything is urgent. So of course. All right. Okay. Any others? Okay, we're good for now. Thanks so much to everyone. As a reminder, first off, Takeout, forgot to mention, there's a great truck out front, Doner Kebab truck. So that's what we'll be doing. And also, tomorrow, we're going to be doing a Facebook Live town hall. And so for all those who do watch, we have noticed that there's a nice ebb and flow of these different briefings that we've had daily since Corona. And they're, anywhere between 30,000 and 10,000 folks usually tune in. And one thing that I did hear from our team that kind of tries to watch what the comments are here and there is that, when do we get a chance to ask comments? So tomorrow is your day, Team Facebook who's watching. So stay tuned for how to submit those. Obviously, we're not going to be able to get to everyone, but I will just try and straight up answer all of those questions. And again, we'll try and do that periodically. We did that a couple of weeks ago, but it's been a while. So tomorrow will be Facebook digital comments only, and we'll spend some time together at 11:30 tomorrow. Thank you so much.